Again, everyone, my name is Marty Guthmiller. I am the CEO at Orange City Area Health System, bringing to you today the 43rd edition of our COVID-19 community briefing. We're going to start out in a more traditional fashion today, and then I'm going to wrap up with a follow-up to our briefing yesterday, particularly regarding senior care. As is typical for our end of the week briefings, we will not have a local scoreboard today. As many of you know, those results come to me weekly, and we'll report on those again on Monday. Every Monday morning we do that. So we're going to jump right now into the Sioux County stats for today. As of today, we have 574 positives in Sioux County. Of the 368 tests. I'm going to change my verbiage a little bit because it's probably more accurate to say it this way. And 3,868 tests, T-E-S-T-S, as opposed to tested, because it's really the number of tests. So it could be, maybe one person has 2 or 3 or 4 tests. And so I want to make sure that that's reflected accurately. So 574 of 3,868 tests represents a 14.8% positive ratio. It's the first time in several months that we've been able to say 14 in front of that percentage. So that's a good thing. Again, not dropping dramatically, but we'll take it. There's 13 new positives this week so far. Region 3, 20 counties in Northwest Iowa. We currently are at 23 hospitalized in Region 3. That is down from Monday's report of 27. So a nice change there. 2 patients in Region 3 have been admitted in the last 24 hours. And we currently have 6 in the ICU in those 20 counties. That number was 7 the last time we talked. So generally speaking, in Region 3, in the aggregate, things are improving. Iowa, statewide, 43,901 positives out of 470,095 tests. Again, we didn't test 470,000 people, but that is the number of tests performed. That rate is exactly the same as it's been for a while at 9.3% positive. Hospitalizations are not on the steady. They're continuing to increase. Iowa hospitalized patients as of this morning, 225. That was from 209 when we spoke on Monday, 213 the time before that, and 195 the time before that. So hospitalizations are going in the wrong direction in the state. But not so much in Northwest Iowa. I'll give you some individual counties here. Sioux County currently has 1 hospitalized patient, O'Brien County 1, Plymouth County 2. That number was 0 on Monday. Lyon County 1, Dickinson 2, Clay 0, Osceola 0, BV remains at 0. Woodbury County remains at 10. They've been 10 for a couple reports now. Polk County in Des Moines, 45. That number on Monday was 41. The time before that was 51. So there is, in terms of hospitalizations, there is some uptick in the state. There's no question about it. Generally speaking, though, that's in central and eastern Iowa. And there are currently 5 counties in the state that have 10 or more patients hospitalized at this point with COVID. We do have 855 deaths in the state of Iowa. That's 26 since Monday. And I want to talk a little bit about, we reported yesterday a COVID-related death in our facility. I want to make sure that you understand what COVID-related is and COVID-related is not. In today's world, you can really die from 3 different things, or in 3 different ways, capacities. You can die from COVID, you can die with COVID, or you can die without COVID. And so when you hear COVID-related death, you know that it either came from COVID or was from a patient that had COVID. And each situation is a little bit different. That is, there's some predefined criteria for physicians to follow in completing death certificates. And I just wanted to explain that a little bit, exactly what that is. The truth of the matter is you don't know, and you likely won't know as a member of the general public whether it is from or with. But that's what you need to know. And so that's a little more detail on that. As a follow-up to yesterday's briefing regarding Prairie Ridge Care Center, our nursing home, I want to give you some background and a little bit more detail. We've learned more today. There's some updates I can give you, and I will in just a moment. Let's start with the Iowa Department of Public Health definition of an outbreak. The IDPH defines an outbreak in a nursing home as 3 or more positive residents within a 14-day window. Okay, 3 or more residents. The website, the IDPH website as of today, lists 5 for Prairie Ridge. What we have figured out is that the 5 represents 1 staff member and 4 residents within that window. And so that's where we get 5. Today, we also learned that of the 3 residents we reported yesterday as testing positive from the rapid test, 2 of those residents were confirmed positive by the PCR test, which is historically and as of late been the most reliable test. And so 2 of those 3 rapid tests were confirmed. 1 of them was not. The PCR came back negative. And because PCRs are more reliable, we're inclined to think that perhaps that resident was not positive. It was a false positive. Again, we don't assume this. We act on it. And so the negative that came back today has been rapid tested again. That rapid test was negative. And the swab for PCR is pending. That's out. So right now we've had 2 of 3 tests for 1 resident being negative and 1 positive. If we get the 3rd test back and that's negative, we're going to deem that resident negative, and we will likely move that resident out of the negative pressure area that we're in. So what I want to paint a picture of here is when you hear of a nursing home being an outbreak, you got to really look behind the curtains a little bit. In our case, what likely will be the case tomorrow or maybe even the next day is that we have 2 residents tested positive that are currently in the nursing home. Those residents are in isolation. They're in a negative pressure environment, which is a step well beyond what nursing homes are required to do. But again, kudos to our maintenance staff to have being prepared for that. We have as safe an environment there as we possibly can, and taking care of these residents as humanely as we possibly can. And even though isolation is tough, they're in a room by themselves, they're comfortable, and neither of these residents have hospitalizable conditions. And so I don't want to downplay the outbreak status, but I want to put it in perspective that likely by the end of today, that's the picture. So you have two residents very properly isolated. And of course, staff members aren't allowed to be there, aren't allowed to work until they've cleared. And so, so the real concern is in controlling the virus within a nursing home is isolate those people, and you are focused on residents only. But again, a little bit of difference there. That what IDPH posts on their website includes staff. What the criteria for definition of outbreak does not. So that's it's probably more than you wanted to hear on that topic. But anyway, we continue to take this all very seriously. 2 positives are more than what we wanted. 1 positive is more than what we wanted, but we're prepared to deal with it. We are dealing with it, and we appreciate the understanding that families and our community has in regard to that. As I close today, maybe a little bit of an editorial here on my part, but I'm growing weary, and I think you are growing weary as well of some of this stuff, and I want to convey some caution a little bit. What I'm growing weary of is some of the hate that's out there, some of the fear that is out there, and this sensationalization of the COVID, where headlines misrepresent the body of the story. And we've been talking a little bit about statistics and how you can make any stat say what you want, and I've given some examples of that. It gets a little old after a while to be dealing in this environment, and that's for everybody. And what we want to be careful of here is we don't want the ultimate impact of COVID to be worse than the disease itself. And when we choose to use a common sense filter as we go about our lives, when we choose to control what we can control, we free ourselves to live our lives. Again, I don't interpret that as being I'm an anti-mask wearer or anything like that. Hopefully by now you know I'm not. But to use that common sense filter to live your lives, be very careful of the stats and headlines that you see and read. Please look into them. If you're going to expose yourself to that news cycle, make sure you back up and delve into what's behind the headlines a little bit. Because it's going to be a burden that we just don't want to bear. So again, let's end on a positive note. Control what you can control. Live your lives. Use the common sense filter. And I really feel like a broken record today, but I really feel like I need to convey that, particularly over the last 24 hours. So this isn't over, folks. The marathon continues. I keep thinking we might get to mile 21 or 22 pretty soon. I don't feel like it. I feel like we went back to mile 18 yesterday, but nonetheless, we're still running. Our shoes still have tread on them. We're still in the game. So we're here. We're ready to take care of all you guys. And I'll sign off with our normal thing. Be strong, be vigilant, and be healthy. Thank you for joining us today.